Do you think the way medicine is now being taught needs to change?
Excellent points in terms of should education keep up with patient needs. I definitely agree with you. And that's where we're seeing a lot of promise. So, for instance, when I had started medical school, it was shortly after Hurricane Katrina had decimated New Orleans, and we had just unfortunately hundreds and we think thousands of deaths there, particularly in the lower income racial minority communities, good people that just couldn't afford to get out. And so when you have these food deserts and these large expanses of the city that just didn't have access to healthy foods, they didn't have access to affordable doctors. And so I worked with a team as I was working on Mom's Clinic back home. I was also trying to figure out how to use AI to bring the best of medicine, the best of public health, the best of AI, and the best of education together. So we were very fortunate to accidentally, as we look back, co-found that culinary medicine movement where we started in an abandoned grocery store and we brought together a school, we brought together our medical school, a local high school, a local grocery store, and a bunch of community organizations where the community itself led the way and they said, we need this. But we want to make sure we don't get lost in the conversation with a bunch of big powers that come in and swoop in and do it their own way. So we tried it at the table together, quite literally the dinner table in our little fledgling teaching kitchen, asked the community, what do you want? And then they told us, here's what's important to us. And we said, this is what we think we can bring together. How can we do it together? And so I tried to bring that kind of by learning by doing approach where I would bring in other medical students and then nursing students, medical trainees, and even eventually attending physicians to be able to eventually develop and try to fine tune this model of learning by doing, the way that medical education can adapt in real time.